All right, so we move to the business van, and workers in the corporate world are believed to be very busy and have little time to concentrate on other aspects of their lives, including their health. Nurse Abdulsalam Mohammed is giving corporate workers the needed time and attention, and he tells his story on this week's episode of the Business Van.
I remember in 2006, I was in University of Ghana Ltd studying nursing, and we had a program, University of Ghana Nursing Student Association. Then the late Major Courage Kashiga visited us, and he spoke about regenerative health. We spoke about how a black community in Israel called Dimona had succeeded in eradicating a lot of communicable and non-communicable diseases. So that was the first time as a nursing student I was stricken by what he said. I felt, okay, what can I do to complement this dream?
That's how Corporate Health Ghana was born. Gradually, Abdulsalam's vision to assemble health professionals serve the corporate world has seen a gathering of 40. With his network of doctors, physicians, a dietitian and many nurses, Abdulsalam dishes out services in the health sector. One major component of corporate health is technology, and for now, the corporate health team is just a phone call away. But with an app, the company will up its game in the coming weeks.
Technology is so easy that whilst they are in their home, in the comfort of their room, they should be able to talk to a doctor. They should be able to book appointments. They should be able to request any kind of health services that they need before even they get to the hospital. So that is what we are doing. Currently, our team of competent technicians and coders are working. We are hoping by 25th of August we'll launch our technology. That technology, what it will do is that, one, it will reduce the cumbersome processes. So just by having your phone, you can be able to request all kinds of health services that you need. And it gives you the opportunity to even make an initial payment. And then wherever you are, we receive your response, and then we are able to put together a team that will actually deliver the...
When Abdul is not running his corporate health business, he still does what he loves, saving lives at the Kolebu Teaching Hospital as a nurse. Juggling both jobs, Abdul says, is not a joke.
It's highly challenging, I know. There are times I've worked nights. I go on work at night, and then when I close in the morning, you go and do your other stuffs. So it's quite a difficult thing to do. It's a dream that sometimes the people around you think that you're crazy. What are you doing? But they don't see exactly what you see, and it's quite difficult, especially mobilizing the team of people. The nurses and doctors who work in the health sector, most of the times are comfortable because by the end of the month you get your pay and what have you. So the biggest challenge is trying to sell the vision, to tell a doctor or a nurse that, okay, beyond what you do, we can come together and do stuff like this.
So tell me, how easy has it been for you to gather money to invest in the equipment you need for this work?
It hasn't been easy. It has to take a lot of personal sacrifice, personal investment, and innovation. I believe so much in innovation. So some of the logistics, you have to source them through partnership and innovative ideas. So it hasn't been easy. I've invested my personal resources, my personal money to get things moving.
When you say personal money, somebody might be thinking, how much? Could you give a rough estimate as to how much you've really invested into this business?
Wow. I think it's something that is difficult to do. I may need to have an accountant and an auditor to sit down and put all this.
Now, speaking of investment, I know you were one of the winners of the presidential pitch, and you were promised how much?
I was actually promised 45,000 Ghana Ltd.
And how far without money?
So this afternoon, I actually received a text message on our group that our account has been credited.
So the money is in, business is going to flourish.
So for me, I'm even eager to just go to the bank and check for sure whether the money has hit the account.
An overly subsidized health sector by government, he adds, is a bad business.
The innovation is the mobile clinic. Elsewhere, mobile clinic is the new approach. You know, if you have a well-fabricated van and logistics and what have you, you can move from community to community to deliver healthcare. It's happening in other parts of the world. It must happen here. Currently in Ghana, government is the only operator of mobile clinic. And it is not functioning very well because government's objective is not business. It's not profit making. If government opens the landscape and make young entrepreneurs like us get into the mobile clinic business as a business, at the same time, we can create a lot of jobs. We can create extra income for doctors, nurses, create more partnership for other health service delivery organizations and partners, whilst also delivering healthcare closer to the people.
It's a growing business for Abdul, and he is hopeful that he can make a difference in the health sector with one corporate institution at a time.
So that was our business van and an inspiring story, Darrow.
Yeah, and I think people are actually very creative. I mean,
especially
just the
young
thought
people.
of being a mobile nurse, so to speak, very, very innovative
well
what
done.
he's doing.
Yeah.
That is it for Business Live. Remember that government says it's going to assist local banks. We're going to bring you the full story on JoyNews Prime when Abuajiri Africa comes your way with the latest in business.
My name is Sandra Isanamapeno.
My name is Darrow. Enjoy your weekend.
Have a great weekend.